junction of the mandible, the bones of the skull articulate with each other through joints known as...
Oops, sorry, that was not intentional.
Throughout the skull, holes known as foramina serve as passageways for blood vessels and nerves. Bones on the surface of the skull encase the brain, protect sensory organs, and serve as attachment sites for the muscles of the head and neck. These bones include the occipital bone, parietal bones, temporal bones, and the frontal bone, as well as the nasal bones, the zygomatic bones, the maxilla, and the mandible. Other bones become more visible only when looking inside the skull. The sphenoid bone makes up the anterior base of the cranium. It is a butterfly-shaped bone with a central body and two pair of laterally projecting wings. These wings form portions of the orbit. The body of the sphenoid features a depression known as the sella turcica, which houses the pituitary gland. Located between the orbits, the ethmoid bone makes up a portion of the cranial floor and also the roof of the nasal cavity. An inferior projection, the perpendicular plate of the ethmoid bone, forms the nasal septum. The crista galli projects superiorly from the ethmoid bone and serves as the attachment point for the falx cerebri, a dural fold. Extending laterally from the crista galli is the cribriform plate, a perforated area through which the olfactory nerves pass. The two L-shaped palatine bones form the posterior third of the hard palate, part of the nasal cavity, and a portion of the orbit. The small, thin lacrimal bones make up the anterior portion of the medial wall of each orbit. A groove known as the lacrimal groove helps to form the nasolacrimal canal, which contains a duct that allows tears to travel to the nasal cavity. The vomer is an elongated, plow-shaped bone that forms the inferior and posterior part of the nasal septum. The internal and external skull bones articulate precisely, forming an intricate structure perfectly suited to its functions.
So that just gives you a nice overview of the bones. So ideally, the first thing you probably will need to learn is go through and actually learn the bone names. They're easier. So the bone and the sutures are bigger and easier. Using the OpenStax pictures, I would start using the ones that are colored for the bones, because that way you can actually kind of see where they start and stop. That's why on Quizlet, I have the pictures where the company has taken and actually highlighted where things are located, so you can actually see the boundaries on things. That'll make it much easier. Unfortunately, in real life, it's not colored, and there are no nice distinctive boundaries like that. So you will have to know them on pictures without those for the Blackboard quiz and the exam. So it's a transitional thing. We just kind of have to go from easier and then getting more difficult. So hopefully you'll grasp the material. Sorry, I'm trying to find my syllabus with all the terms on, but I need to find it right now. So the other thing I would look at is before, when you do the structures. Okay, so just a reminder, sutures are the attachment points between the bones. So they're fused together, but there's a joint there between each of the bones where one starts and the other one stops. So there's a few sutures you have to know. A bunch of those are named after things you've already learned, like coronal, sagittal. Those are words you had to know when we did the terminology, so hopefully that shouldn't be too bad. Then we throw out a couple other ones, like squamosal suture. You learned the word squamosal. When we did the tissue stuff, it just means scale-like. So somebody thought that suture looked scaly. And then there's lambdoidal, which is based on its shape, but I always remember it's very convoluted. It goes up and down. It kind of looks fluffy, if you will, like a lamb. So those shouldn't be too bad. And then there's one on the underneath side, which is the palatine, median palatine suture. So if you think of palate like taste, so that's the roof of your mouth, and then you learn the word median, it's the middle of it. So the sutures shouldn't be too bad. Some of the bone names are, again, the terminology, you learn some of these. Frontal, it's on the front of your head. Nasal, it's on the top of your nose. So some of those shouldn't be too bad. Sigmoid and ethmoid are probably the hardest as far as their names go, just because they're a little more complex saying terms versus frontal or nasal. But I don't think you'll have a whole lot of trouble with the bones. The hardest one to remember is the inferior nasal concha, which is on the inside bottom part of your nose. It's inferior and it's inside your nose. So the two words, inferior and nasal, shouldn't be hard. Just remembering it's a bone and it's stuck kind of at the base of your nose. And then concha or concha means kind of shell-like. There are shells that are conchas. So those shouldn't be too bad. And then you've got the mandible and the maxilla. And those are ones that we probably learned with kids without much problem, because that's our jawbone and our upper jawbone. So I don't think those would be hard. So now if you move on past the bones and the sutures, then the more challenging stuff is getting into the holes and the pieces that stick out, the projections. So those will take some practice. Some of them, their names are intuitive. Styloid, if you think about it, we actually use styluses now again. It got its name, of course, probably in the 1200s when they were doing a lot of these dissections. They used it as a pen. They actually had dippets, but it's similar shape, long and skinny. If you remember, to masticate means to chew. There's a mastoid process, which is the big bump where your jaw attaches, your jaw muscles attach. So some of them are going to be more complex than the other. If you're somebody who likes to know how their names came about, in the supplemental folder in Lab 4 folder, I went through and I put down how the bones were named, what runs through them if it's a hole, what attaches to them. So it depends on if you are somebody who really likes to know that kind of stuff or not. So I guess my question now is, do you feel it would be beneficial for me to pull up a camera and just point to stuff on the skull? Or would you rather try to do that by yourself? So you can either type in the box or I can do a poll here. The other thing I can go through is just highlighting what's in the Lab 4 folder. I can go on the visible body and remind you on some stuff on visible body if you're concerned about how to use visible body, but that's not due until next Friday. Quizlet and the Blackboard quiz are due Sunday. And then the visible body tagging and the visible body quiz is due next Friday, not 2 days from now, Friday, but next week, Friday, which is what, the 26th, or is that a Sunday? Yeah, 26th. So let me see if you don't want to actually turn on your microphones. But the skull is going to be a lot of stuff, so I need you to help me understand what you think is going to be the best way for you to learn this material. Do you want me to go through the skull? Skull model on camera. So I guess the question is, for those that are saying no, you've checked in. If you don't have any other questions, I can give you credit for being here today and we can leave. You can leave. And the person who is saying yes right now, if you want me to do it, I can do it for you. So it doesn't have that everybody's stuck. I have not put a video up on Blackboard yet. I will work on that today. But in Blackboard, there are a bunch of pictures. The pictures down below, which are called the colored suture skull, that's the one that the key's in your lab handout. So if you look at your lab handout for lab 4, you'll see that there's a key in there with numbers next to all the structures you have to learn, bones, sutures, and structures. Those are where those numbers come from. The ones on the top that are pictures from an old lab manual, I have to work on the keys for those, but I'll get those posted. So I would start with the pictures down below if you want something that actually has a key. Otherwise, if you use the OpenStax pictures, you can just go through and find and start learning this stuff. You can, I know people can use their PDFs and they can highlight on there, so you can go through and highlight when you found something, or of course you can print it off and go through and check off when you found it, because it's not going to be in a perfectly great order. So you're going to have to do the best you can as far as finding what works for you. You can go through and just start doing stuff on Quizlet if that works for you. So things like that skull are going to be challenging. But I will remind you that some of the bone marking terms when you're going through this. Foramen and a canal are holes. So if you see the word foramen or canal, you know you're looking for a hole. The difference between a foramen and a canal is the canals are deeper. They go a longer distance through bones. Foramens generally are relatively short. They just go in and come right back out. There's not a whole lot of depth through that hole. Processes, or process is something that just sticks out, so there's a bunch of those. There's a condyle on the jaw. A condyle is a kind of rounded surface where a bone's going to rotate. A line is just a long raised area. Fissure, yeah, you're only going to get the fissures in the skull, and the fissures are only in the inside of the eye socket or the orbits, and fissure is long, skinny. So it's a hole, but it's long and skinny. It's not just round. It's more oval-esque shaped. So hopefully, this is why I asked you guys to learn the bone marking terms, and there's 3 bone marking terms on the mini exam this week. So hopefully you will learn those, because they are pretty much going to make your life much easier if you have some clue what in the world it's talking about when it says foramen, or condyle, or fissure, or line, or notch. So I guess before I move on to the new material, the skull, so let's double check. Everybody's okay with the midterm? So the midterm was originally scheduled just to be Friday, but I decided I'll give you guys 2 days just in case some people want to get it done and over with. So it will open tomorrow morning at midnight. I'll always open them at midnight and close them at 11:59, just because I can't predict what you guys' schedules are. So you can take it as early as tomorrow morning at midnight if you want, or it has to be completed. I stress the word completed because it will shut down and it will turn in your exam at 11:59 on Friday night. So you can't start it at 11:59. It has to be done by 11:59. So to make sure you get it done, please do not start it any later than probably 11 o'clock on Friday night to make sure you get it completed in time. It'll be just like the Blackboard quizzes that you did last weekend. It'll be pictures. So it'll be the pictures from that folder on Blackboard. So the ones with the key that you have in your lab handout. So you'll be familiar with those pictures if you've gone through and used them. So just make sure you can recognize it. Otherwise, yeah, it's just like with the Blackboard quizzes, it's set up because you're using Respondus that the questions will all be shown at the same time. There'll be 25 of them. There is a box at the top where you can click on each of the questions so you can bounce around, or you can, of course, scroll. And if you submit the answers, the box will tell you that you've already submitted the answer, saved the answer. You can still change it up until turning in the whole test. So it shouldn't, now that you're familiar with Blackboard and using Respondus, hopefully it shouldn't be quite as daunting as it as it was maybe last weekend because you weren't familiar with how to use that program. But you will have to type it in. You will have to spell it correctly. I always tell you that spelling counts because it does. I get very little leeway on spelling. The biggest thing usually when I go back and regrade the quizzes is looking for things that maybe you switch the words, and unfortunately the computer is black or white. It can't give you a correct answer if the words are switched from what I typed in on there. So, is there any other questions about the exam? Is everybody else okay on the exam? 2 days to get it done. You have to use Respondus, fill in the blank. I sent when I finally got everything finished last night at about 1 o'clock or 2 o'clock in the morning, I sent you guys the breakdown. So I don't know can't remember all of them off the top of my head, but it itemizes the different terminology categories. It itemizes the tissues because you got location, you've got structure, and then you've got tissue type and the tissue's name. So watch the terminology there. Yeah, there's not as many definition terminology problems I'm worried about now, like structure, bone, suture, that we'll get on the stuff we're going to do here on the bones. It's pretty much, if it's a cavity, it's a cavity. So be as specific as possible. The only thing to be careful is watch for tissue name, tissue type. And then if it asks for the function of the tissue, or not function, location of the tissue, or if it's asking for a specific structure. So some of the little things within the tissues. Otherwise, the rest should be pretty self-explanatory. I guess on the skin, you have to make sure you know the difference between a layer and a structure. And watch my terminology, whole layer, so dermis, epidermis, hypodermis, versus specific layers, so papillary layer, reticular layer, stratum corneum, those kind of stuff. Those are, unfortunately, they're both layers, just they don't have a whole lot of distinction to them except for it's a specific layer versus the whole layer as one. I don't know how else to word that, so just be aware that if I want dermis, I'll ask for the whole layer. If I want reticular, I will ask for the specific layer. I think that's about it for the exam. So unless those of you that don't want to look at the skull, have any other questions, you are free to bail. This video will be posted, so if you want to come back and look at it, you'll have the ability to do that. But I will give you out today. But pretty much that's what I'll be doing for the bones the next few lab periods. So I'll do a brief video if I can find something that's nice online, because they have better quality pictures than what I can do sitting in my living room. And then I will try to pull up my camera and see if I can point to stuff. We're going to see how well I can manipulate the skull on camera or not. But I hope to actually try to do a videotape of me pointing to the structures and post that in addition to this Blackboard Collaborate Ultra recording. So you'll have those if you want to use them. My goal for the video I make is that I will pause, then say the name, so you can also use it as kind of a quizzing system. You can hit stop or pause, then you can try to name it, and then you will listen to me say it, so that way maybe that will help you quiz that way too. Okay, so let me see if I can get my camera up and going, and we'll just go through, start with the bones and the sutures and work our way through the list here. It's a lot of stuff. Actually, the appendicular is significantly worse than this, but luckily it's a lot of individual bones, which makes it easier. The fact that the skull is so dense, everything is right on top of each other, makes it way more challenging. Whoops. Okay, skull. So this is the skull we have that we use AAUM. Well, we actually have two of them, but this is the nicer one. That's why I brought this one home with me. So I don't know what's the best way to do it. Maybe start at the front here. So I'm going to take the mandible off. So one of the bones you have to know is the mandible. So of course your jawbone. We'll come back to him here in a minute. So that is a bone. So that's the mandible. And on the front here, this whole one that has the upper part of your mouth and your teeth on it here is your maxilla. That's a little fuzzy. Cheap cameras. Let's see what I can do here. Yeah, I don't think that's as good a quality as my camera's going to get, but it should hopefully be okay. You get the gist at least, even though some of the fine detail might not be perfect. Then on the side here, you have what makes up that cheekbone. So the people that have a really nice defined cheek, if you will, it's this zygomatic bone that you're seeing. So we'll get through the big ones here first. There are two. So a lot of things in the skull are mirror image. There are one on each side. So just realize on those pictures, label may be on the left or the right side, but for most things, they're going to be duplicates of them. There are some bones that don't have duplicates, and there is an outline of that in OpenStax. So you're going to go through and do the bones. So like the frontal bone here does not have, there's no suture down the middle, it's just one bone. But the nasal bones here, there are two of them. The zygomatic bones, there's one on each side. The maxilla, there's actually, because there's a suture down the middle here, there's actually two of those also. So a lot of the bones there are two of, because it's got a suture in the middle, and there's mirror image or duplicates of everything. That's true for a lot of the processes and the foramens. So just realize if there's only a number on one side, chances are there's an identical on the other side. And somebody, on the exams and quizzes, could ask either side. So please make sure that you can find it on both sides. I can't number both sides. It would just be a mass of numbers, and it would be too chaotic. So if you have problem doing left and right on this stuff, let me know. That becomes more important even on the appendicular bones when we do it next week, because I'm just going to randomly select bones. So it could be a left, it could be a right. So make sure that you're able to switch between the sides of the body. So what else can show you here? So remember I mentioned that there's a bone inferior nasal concha. So that's in here in the nose. I don't know if I can turn it enough you can see. So way in here, it's a little hooked like bone on each side. So there are two of them. That is a bone. Generally, they don't put the word bone after it, but it is one of the bones in the body, in the skull. Then let's see if we can turn. So let's see if I can get in the nose. The thing about the sphenoid and the ethmoid bone is they are inside surrounding your nasal cavities, your sinuses in your skull. So they're stuck in the middle with other bones around them. So they attach in a bunch of different locations that make it look like separate bones. They're actually one complete bone. They just attach in locations where they just poke through where you can see them. But in the tiny little tip here in the front is the vomer bone. If you remember in that video, I said it was plow shaped. So it's kind of triangle. So it's pointed in the front, gets wider to the back. So this piece right here is the vomer bone. We'll show you the back side of it here in a minute. But from there up, you will see that there's this bone that runs in the middle of the nose here. That's the ethmoid, or one of 4 or so locations where the ethmoid bone comes. Most of it's inside your nose, and it's convoluted because it allows you to filter air. It has a lot of that hairs and stuff attached to it. The mucus is all on those little bones on the inside of it. It's intentionally kind of convoluted because it allows more filtering to go on, but it makes it a little harder to identify it because it's here on the inside of the nose. see if I can turn it and show you here. But also is this piece here on the inside of the eye here. And then when we get to the top of the skull, it also pops through on the inside of the top of the skull and is associated with our olfactory bulb, so our smell. Let's see if I missed anything here. Yeah, I wish I could figure out how to make the lighting better. I've tried everything and it's just hard to do. So let's see if we can go into the eye socket or the orbit here. So we talked about the ethmoid bone here, but if you can see here, there's this little bone, and I can tilt it a little bit. This little bone on the inside of the eye here that has a lacrimal duct in there or has a hole that goes with that. You don't have to know that terminology, but the bone is the lacrimal. It has to do with tears. It's got our tear duct in it. So again, if you're somebody that likes function to help you with stuff. So I think that's the main ones that you can see from the front. Oh yeah, just in the back of the eye socket here, this piece here is part of the sphenoid bone. Again, that's another one that has a bunch of pieces that pop out here, there, and everywhere. So let's turn to the side now. So the lateral view here, we already did the zygomatic bone. You can still see the frontal bone. Then this suture here, which is that squamosal suture because somebody thought it looked scaly. This bone below it here, which has a piece that comes across, which makes up part of the zygomatic process here. So your big muscles go through here for your jaw. This is called the temporal bone. So if you think about it, if you rub your temples when you're stressed out, or that divot kind of on the side of your head here, which is your temples, it's named after the fact that this is the temporal bone. And then there are two on the kind of back top here, which are the parietal bones. And there's a suture that goes around the front here. So I'm going to turn you to the top so you can see a little better. So you've got your coronal suture, because it's the crown where your crown would sit. And then the sagittal suture, dividing it in the middle. So this is the parietal bones here. So 9 big bones to make it the bulk of our top of our skull there. So then if there's not a whole, we already did the zygomatic, you can still see the maxilla on this view. There's not a whole lot of new bone, just these two that we added in here. Now if we kind of turn to the back here, the back of the skull here, ignore the suture that goes across here. This is still all what they call the occipital bone. So then the harder ones and the view that learned stuff is this underneath side view here. Yeah, that's super blurry. Oh, eBay. I'm trying to see if I can figure out a way to make this camera get invisible enough. It's blurry, but I know my camera is terrible. So this bone here is the palatine bone. So the roof of your mouth, palate. So this is still the maxilla here. It's got your teeth attached to it. But these two little bones here are the palatine bones. And you can see the occipital bone comes all the way down to the base here and goes around where the opening for your spinal cord is. Now the hard ones to probably show on video here are going to be the sphenoid bone. So the sphenoid bone is this butterfly-shaped bone. So this one is one that you really use the OpenStax picture or any pretty much picture online you can to see that it's kind of butterfly-shaped. The butterfly shape is much easier to see on the inside. So I'm going to open up the skull cap and we're going to look in the interior here and see if I can get the lighting good enough that you can actually see that it's butterfly-shaped. So if you can do the best you can with my terrible camera here, you can see the lines here. And if you look at it, it's shaped like it has a wings and a here, so it kind of looks like a moth. It actually has a lesser and a greater wing, so they actually name it because it looks like wings. So it's got all this is the sphenoid bone. So that one kind of makes the back of your nasal cavity, and then up here is where the rest of the ethmoid bone is. because it comes up and allows your olfactory bulb to sit on top of that space there and sends smells from the mouth up into your head here. So that is the bones. Let's finish up the last of our sutures here. So we did the coronal suture. So just to orient you, we're looking, so the front of the head is here. You can't get it all in very well. Front of the head is here, so you got your coronal suture, that's sagittal suture. So I'm just doing that so you can see it coming back to this what looks fluffy, which is how I remember it's lambdoidal suture. It's this kind of jagged one in the back here that separates the parietal from the occipital bones. So there aren't that many sutures, so that's not too bad. So I'm thinking the easiest way to start getting the smaller stuff is to go through the mandible and then come back to our more difficult piece. So the lighting is terrible on that mandible. Let me see. I wonder almost if I turn off. Let me turn off my lights and see if that makes it any better. Now, unfortunately, I've got those closed, but it's still making a terrible glare here. Well, we can get some of the basic things. So foramen-wise, in the mandible, you've got two that you have to know. This one on the front of the mandible here is called the mental foramen. The mental foramen, remember, mental means chin. You had to learn that in the terminology. You think of mental as meaning head, like crazy, something going on in your head, but actually mental means chin. If you think about, there's I'm trying to remember, I don't know who the sculptor is, that doesn't matter, but there's a sculpture that had a naked guy sitting with his hand on his chin, and it was called the thinker. So that's why they came up with the word mental, meaning thinking. It's because when you would sit and you were deep in thought, you would put your hand on your chin, but mental actually means chin. So this is your mental foramen. Then the other one, so this is the front. So looking at the back, there is a hole in the back here. It's a weird angle. Let me see if I can get to it. It's a problem. So you can see there's a hole in the back, which has nerves and blood vessels run to feed into the teeth. So when you get your root canal, this is the nerves running through there. That is called mandibular foramen. So not hard because it's named after the fact that it's a hole in the mandible. So that's the foramen. So let's go and do some of the other stuff here. So we got the mental foramen. Then there are two raised areas. This one's called the oblique line because oblique means at an angle, and the line is at an angle. So it's unfortunately somewhat difficult to see on this picture, but there is a raised area right here. So some of the nicer pictures on Blackboard will help you see that. Then you have the coronoid process. Coronoid means crow's beak. Somebody thought it looked like a beak. Then you have the mandibular condyle. So this rounded thing here, rounded structure, it actually what allows your jaw to move back and forth and all around. Then you have to know the notch. So named after the fact it's in the mandible, so not hard again, mandibular notch. One of the slightly harder ones is that this raised area here, so if you pluck the teeth out, there's a raised section of bone here, which is called the alveolar process. It's also on the mandible, but we don't ask you to know it on there. So that's what has the teeth in it. Then all that's left is that there's one other guy on the back here. So hopefully you can kind of see that because it's darker here, the shadow. This is a raised area back here. This is called the mylohyoid line because it's Mylo means muscle, and hyoid is a bone. The only bone that doesn't touch another one. It sits underneath your chin, helps anchor some of your tongue muscles. That's what attaches to this raised area. That's the muscles of the hyoid. So it's giving you some information about what it does. So that's the mandible. So hopefully that's not too bad. Now, the easiest spot on this guy to start is from the front, then the side, and then unfortunately the underneath side and the inside are the ones that's going to be a little rough. There's a lot of stuff and it's all kind of crammed on top of each other. So some of the foramens here. So there's a hole underneath the eye socket here, which is called the infra-orbital foramen. So look at the words, and some of these you can break down. Infra means inferior, so it's below the orbit. So infra-orbital foramen. Then you can see back here you have these two long slit-like holes. So you have the superior orbital fissure and the inferior orbital fissure, because it's at the top and it's at the bottom. And the orbit is that circular hole where your eye sits. And fissure is a long, skinny, slit-like bone hole. And the fissure was one of the words you had to know for the bone markings. Let me see. Besides, okay, the bones, I don't think there's anything else in there you can really see. I guess maybe if you try really hard, you can see way in the back here. There's a hole back in there. I tried labeling on the picture, but it's a terrible shadow. But there is a nice round opening back here. Maybe if I put my pink, I've got a pipe cleaner, which sometimes helps if you shove it through holes. If I can find the pipe cleaner. I seem to have misplaced it. My cat keeps wanting to run off with it, so. Okay. So pipe cleaners are nice because you can stick them through the holes, and I can show you where it comes out on the other side. So remember, most of these holes are going to go all the way through. So in this case, it comes out up here. This one's not too difficult. There are really large optic nerves which feed sensory information to our eye. That's the optic canal or the optic foramen. You'll see it both ways, so I'll give you credit for either one. So your big optic nerve comes in from the eye and comes up and runs to the brain. But that hole is kind of in the back there. And I'm kind of getting a little bit of a light on it so you can see it back there. Nice little round circle back there. So those are the foramen. And the fissures, oh, here's one I missed, yeah. So it varies from person to person. This can either be a hole or a notch. On this one, it's a notch, so it's the superior side of it. So this one's the inferior, this one's the superior. So it's infraorbital, and this one is supraorbital, and it's a notch. It's one of those rare anomalies where some people have a hole, some people have a notch. It's a genetic variation. On this skull, it's a notch. So I'm pretty sure that, yeah, your key says notch. So that's the words we want you to go by. There may be some of the pictures you find online that calls it a foramen, because it does actually vary. And I think that's all the main stuff on the front besides the bones. Oh, okay. Inside the nose here. So we talked about the vomer bone and the inferior orbital, the inferior nasal conch of the bone and the vomer bones here. But in the middle, we said this was the ethmoid bone, but that structure that divides the left and right side of your nose actually has its own name. It's called the perpendicular plate. So here's where you need to be really careful on the quizzes and exams. If I'm asking for the bone, I want the whole big bone, the whole thing. But there are smaller parts to it, which I'm going to call structures. Structure is just a generic word for something smaller out of something bigger. So if I ask you for the bone that this is part of, it would be ethmoid. If I ask you for the structure, the one that runs up the middle of the nose here is the perpendicular plate. It's flat like a plate, and it's perpendicular because it runs up and down to the rest of the bones in that part of the skull. Let me see if I missed anything else. Yeah, there's not a ton on the front. That's why that's probably not a bad place to start. You can see the mastoid process here. And then underneath here, you can see this little sharp pointy piece, which is the styloid process. It'll be easier to see when we flip it upside down. The problem is if you can't have enough contrast, sometimes the styloid process just blends in with everything else because two-dimensionally you can't see the depth. So there's not a lot on that except for, remember we talked about the sphenoid bone looks like a moth or a butterfly. This bone goes all the way through, but on the outside and on the inside here, it's labeled, and this specific part is called the greater wing. The greater wing is the structure, the bone it's part of is the sphenoid. And on Blackboard in the supplemental folder, I do have a list of all the structures and what bones they're housed in, if that helps you guys. So on the back, on your occipital here, there's this bump. So you can actually feel, so if you feel on the back of your head, you can usually find this. Some of the muscles in the back of your skull attached to this. So this has 3 words. It's on the outside, so it's external. It's on the occipital bone, so second word is occipital. And then it protrudes or sticks out. So it's external occipital protuberance. Is that bump on the back of your skull here. So that is most of the ones you can see on the easier side. So unfortunately, now we get to the hard sides. So the inferior view here, see if I can figure out how to get it all in my camera here. So on the pictures on Blackboard, I did the whole underneath side, and then I took it and I divided it in 2 pieces so you could zoom in a little bit. I'm going to see what I can do with my camera. I'm having trouble. I don't know how to make an external camera focus very well. But we talked about the maxilla and the palatine bones, and that there's a median palatine suture that divides those. That's all you have to really know up there. Then remember I told you that vomer bone is kind of triangle shaped, little in the front, bigger in the back. So this all right here in the middle is the vomer bone. So now some of the structures you have to know. If you look here, you can see there's this weird little spiky pieces that come out the side here. Those are called the pterygoid processes. They look kind of winged. And if you think of like pterodactyl, it just basically means winged dinosaur. So it just means it's winged. So there's these 2 little wings on both sides. So remember, there's a lot of them are mirror image here. I'm not going to start with the foramen. There are a lot of them, they're hard, so we'll come back to those. But if you can see here enough that you can see it sticking up, this is the styloid process. So it looks like a little pen or pencil sticking up there. Then that mastoid process is the big bulbous thing that our jaw muscles attached to. Then it's hard to see the texture on here, but these are called the occipital condyles. Remember, condyle is rounded because the bone will rotate or move with that. This is where your cervical vertebrae at the top will sit and rest. Of course, this big hole here, which this foramen I think I can do real quick, is the foramen magnum. It's gigantic. It has your spinal cord running through it. So your vertebrae will attach on here, and of course your spinal cord will keep going. Here, if you can kind of see, it's indented here and over here. This is where the jaw will rest, that mandible. So another fancy word for something that's indented is fossa. So that's the mandibular fossa. So it's telling you it's indented, and it's telling you what sits in it, which is the mandible. Now, the hardest part of these guys are going to be these foramen, so all these holes and canals. You can learn them in order. There are some mnemonics for them, but there are so many of them, generally there's not a mnemonic to cover all of them. And the mnemonic for the holes in the sphenoid actually includes one that you can only see on the inside, but I'll show you them on the outside and then we'll do the inside here. But their names are trying to give you some clue. So this one up here is the foramen ovale. So it's oval shaped. Oval with an E is how it's spelled. Then you have this one here in the middle. It's kind of jagged looking. It's the foramen lacerum. It looks like somebody took a knife and just kind of chopped at it, lacerated. Then if you can look really carefully here, there's a teeny little hole right there. The teeny little hole right there is this foramen spinosum. So spine, makes a little hole, something spiny. Then some of them are named after what runs through them. So this really big hole here, which unfortunately the skull companies can't drill it out, it does go all the way through, is the carotid canal. So I'm sure you've heard about the carotid artery, the really large guys in your neck. Take your pulse with those because they come directly right off the heart. So that's what runs through there, is the carotid artery. And then I'm going to tilt and try to see if you can see this one, because it's gigantic. You can see it better from the back. But this big hole, it kind of is kidney bean shaped here. That's the jugular foramen. So carotid artery and the jugular vein sit right next to each other in your neck. So this is coming straight up from along your neck from your heart. And see if I can tilt a little bit. So underneath the obstacle condyles here, there is a canal or a hole that runs through here. It'll go all the way through into the inside here. That one's actually named after a nerve. You'll get to the nerves here in a couple of weeks, but it's called the hypoglossal canal because the hypoglossal nerve runs through there. So unfortunately, you haven't learned the nerves yet, so you're kind of having to learn that term before. But hypo and glossal, if you break the word down, glossal means it's sending nerves to the tongue, and hypo means the bottom of the tongue. Then this one should be a little easier than some of them. So you get your styloid process and your mastoid process here. There's a hole that runs in between those. It gets its name because it's named after the styloid process and the mastoid process. So it's stylomastoid foramen. So that one, hopefully, again, if you break it down, it gives you some hints here. I am all about alarms going off, now the clock's going off. But that's the hardest stuff on the underneath. I'm just glancing through, making sure I don't miss stuff. We add and subtract stuff every semester, so sometimes it's hard to remember what's been added and subtracted. So I don't want to miss something. But let's do the hardest of all the views and look on the inside. Oh, here we go. I missed one on the side. So our ear canal. So this hole on the side here is where sound comes. So our pinna will be on the outside of this here, and the hole in the middle of our ear leads into this hole here. So that's called the external acoustic meatus. Meatus is just funnel-like hole specified just to the ear. Acoustic and auditory can be changed out. Those you can interchange. So this is the external. So since we're talking about this, go in the inside here and find the internal. It is so hard on the pictures to try to make this show up. But if you look here and over here, you can see the shadow here. There's a hole there. That's the internal acoustic or auditory meatus. So it's the inside of the hole where our ear is. So we do have stuff that goes from our ear nerves and stuff that run from our ear to our brain. So this, you have to make a hole to get through the skull. So that's where the nervous impulse comes. Of course, the external has the sound coming into it. And this weird thing that looks like a strange rock here is a cavity that has our ear bones in it. So on the back side here, you can see this is that kidney bean shaped jugular foramen. It's easier to see on the inside than it was on the outside. This hole here, if I can turn it enough to see it, is that hypoglossal canal coming on the inside. Of course, our gigantic foramen magnum there. So this structure here is called the sella turcica. It has a bunch of parts to it. You only have to know one specifically, which is this indented piece in the middle here, which is called so the brain sits on there, and there's a part of the brain called the hypophyseal. That's your fancy name for your pituitary gland. So this is called the hypophyseal fossa. But all of this, which I put a big circle around it on the pictures on Blackboard, is called the sella turcica. The sella turcica translates into Turkish saddle. It looks like you could sit in here, like you would put your butt in here, and you could hold on in the front. So the memory cue that a lot of books will mention is Cowboy Ross. So R-O-S is 3 letters that go with the foramen. So the foramen rotundum, which you could not see on the underneath side because it actually goes into the orbit of the eye and it's so hard to see in there. So foramen rotundum is the R. Foramen ovale is the O. And foramen spinosum is the S of Ross for that cowboy. Cowboy Ross, he sits in his saddle and he lays his lasso at his side. So that's why this hole here, which is the lacerum, is his lasso, is the foramen lacerum. So that's just a memory cue for doing it. I don't always go for the Cowboy Ross. I just go for the fact that you could do Rossole if you add the L in there, or you could do rolls, R-O-L-S. So luckily with that vowel in the middle, you can kind of make it into a word if that helps you or not. But remember the foramen rotundum you can only see on the inside. So on the underneath side, you will only have the O, the S, and the L. So the foramen can be challenging, but if you break them into pieces, it should be okay. And there is a mnemonic about lazy owls that I meant to try to pull up for you guys, but I had trouble finding it yesterday and I forgot to do it, but I can copy and paste that mnemonic into Blackboard if it helps you guys. So look out there, there's not a lot of mnemonics for the foramen in the skull. For whatever reason, there's mnemonics for everything, but nobody's taken the time to try to come up ones for the skull. I came up with ones for all the foramen. It was terrible. Nobody but I would ever have remembered it. So if you guys come up with any good ones, please feel free to share. The discussion group is always open, so you can post stuff in there, or if you send it to me, I can share it with everybody else. The other one, kind of memory cue that people have, is baby Krista sits in her crib. So this is the ethmoid bone, but there are 2 structures in here that we ask you to know. The Krista Galley, so that's baby Krista. And then the bottom part with the holes in here is called the cribiform plate. So Krista and her crib. So Krista Galley and the cribiform plate. Your olfactory bulbs sit there, and those little holes are so that the olfactory nerves can go down into our sinus cavity where we detect some of our odor. Then while we're up here, just to realize this is still the frontal bone. So your brain sits in here. Then remembering again, this is that butterfly-shaped bone, which is the sphenoid. The parts of the sphenoid besides the holes, which we talked about. The hypophyseal fossa, and then the general term for that whole area is the sella turcica, or the Turkish saddle. Don't call it that. Just use it if it helps you know what it is by translating it into the English. Then we have our wings. So the upper shelf here is the lesser wing because it's significantly smaller, and then the greater wing of the sphenoid. That optic canal or the optic foramen comes in to the brain from here. And I feel like I've missed a bunch of stuff. Oh, well, we can do the bones. So this is the inside of the bone here is the temporal bone. This is all temporal bone. And then the whole back half here is, this is all the occipital bone. So the foramen magnum and that hypoglossal canal sit in the occipital bone. Did I miss anything? Let me skim through. No, I think I got everything. So it's a lot, so break it into pieces. Most people will start with the sutures and the bones because they're easier, bigger things to do. And then you can divide it into pieces. You can go through and learn all the processes. You can go through and learn all the holes. You can learn based on what's in each bone. So learn the stuff in the ethmoid bone, frontal bone, parietal bone, occipital bone, if you like to break it into smaller chunks. The numbering is kind of here, there, and everywhere. I didn't number the skull company did, so I'm sure they had a process in mind when they did it, but it wasn't easy. Go through and work on Quizlets. So you have to find a way with all these anatomy terms, the whole entire semester. It comes down to you finding what works for you best. Are there any questions? I know we lost a lot of people during this time. We're down to 3 people left. So the 3 that are left, do you guys have any questions? So it's a lot. Luckily, because we postponed some of the stuff, you've got a few extra days. That's probably not a whole lot lucky. In the summer, nothing is slow. There's no way around it. But you've got Wednesday, Thursday, Friday, Saturday, Sunday. Hopefully, if you read the stuff from lab 1 to 3, you can get the mini exam done tomorrow, and then you can work on Thursday, Friday, Saturday, and Sunday on the skull to get the Quizlet and the Blackboard quiz done it with, and then finish up with it. Earlier is always better, but you have until Friday to finish up the visible body stuff. Then unfortunately, appendicular, which is Wednesday and Thursday next week, has as many structures as the skull, actually a little more, but you can break it into small chunks. You can do just the arm bones, just the leg bones kind of stuff. The skull is just very dense. There's a lot of stuff all crammed in, but it serves a purpose. And unfortunately, a lot of things can go wrong. So there are a lot of pathologies in the brain and the skull. So knowing these terminologies is the only way you can talk about it. It's that language thing I keep mentioning. Until you've got the language down, there's nothing else you can really relate to other people when you're having conversations, especially if you're going into the medical field. So, okay, I will stop sharing this skull if you don't have any questions on this. And I have a strange feeling that the 3 of you that are left are probably just napping. So I will leave that be. I recorded this, so at least this will be up.